Good evening, and it's Monday evening, and we have another great show for you tonight. We are here at Fresh Natural Live, and we're going to talk about this interesting procedure called the Brazilian butt lift. I came across a number of other social media influencers talking about some high death rates related to this surgical procedure. I did a little bit of research on my own and saw some things that were quite appalling about this. I invited a special guest on tonight, a good friend of mine and colleague who is a plastic surgeon who's going to talk about the whole general scope of plastic surgery and help us understand this whole concept. Oftentimes when things are reported in the news, they're often skewed in one way or the other, and we don't get a good amount of insight in terms of the background of, what is plastic surgery, what is cosmetic surgery, and why are these complications so high. So we're going to try to get into the nuts and bolts of this, talk about, plastic surgery in general. And with an expert here with us, we're going to get into some of the details in terms of the levels of training. So if you're considering having some kind of a cosmetic procedure or a plastic surgery procedure, I think there's some information you can gain from this, not just as it relates to Brazilian butt lifts, but as it relates to cosmetic surgery or plastic surgery in general. So stay tuned. We have a great show for you tonight. Okay, welcome back. So what I want to do at the outset, I'm going to play a couple of news clips that gets to this issue that we're going to address. I think they're very telling, and there's some tragic stories that's involved here. But I think I want to set the tone because it's really important that we get some insight. So these are news stories. There's some positive things about news stories, but sometimes there could be some misleading things. So I'm going to share some of the information that I saw online. Let's take a look.
We begin with another tragedy at a plastic surgery clinic in South Florida.
A woman undergoing a procedure there has died after she was rushed to a nearby hospital. Local 10 News reporter Nicole Perez live now in Southwest Miami-Dade with our new details tonight. Nicole.
The clinic released a statement saying they are dedicated to investigating what happened here today and that they will be fully transparent with their patients and the public as soon as they get more information.
Miami-Dade police conducting a death investigation after they were called to a cosmetic surgery clinic Friday morning for a patient in distress. It happened just after 11 a.m. at MIA Aesthetics at 9300 Southwest 72nd Street. We spoke to Cochi Martinez, who said she heard from someone else that a woman died after having a procedure done.
This morning, some 26-year-old came in to do some buttocks implants. They're going to take, from part of her body, from her stomach to implant in her buttocks, and she died.
Can you talk about what went on today?
We tried speaking to one of the employees from the clinic, but they ignored us. According to police, emergency crews tried to resuscitate the woman before transporting her to Baptist Hospital, where she died. MIA Aesthetics released a statement saying in part, quote, "We are deeply saddened to share that an incident occurred at our Miami clinic today, resulting in the tragic loss of one of our patients during a surgical procedure. Our condolences, love, and support go out to her family during this difficult time."
They go on to say that they have performed thousands of surgeries, and this is the first and only death. Reporting live in Southwest Miami-Dade, I'm Nicole Perez, Local 10 News.
So I want us to put a footnote there. So I want you to put a footnote in how the appearance of that building. I'm going to show another clip, and then I'm going to bring on our special guest. This is another clip. It's a little bit longer, but there's some interesting information here. Take a look.
That urgent warning about the possible dangers of plastic surgery to get a look like Kim Kardashian's. Experts say the surgery is one of the most lethal if it is not done correctly. And Diane Macedo is back and has more on that.
Thanks to celebs like Nicki Minaj and Kim Kardashian, voluptuous booties are in. But the American Society of Plastic Surgeons has a new and urgent warning about the large number of deaths they say occur during a procedure called the Brazilian butt lift. According to the society, as many as 1 in 3,000 patients die, making this potentially more dangerous than any other cosmetic surgery.
You have an increase in number of doctors who are attempting to perform this procedure. And unfortunately, a lot of these doctors are not board certified.
The Brazilian butt lift is meant to make a rear more shapely. It basically combines liposuction with fat grafting, sucking fat from where you don't want it, like the thighs or stomach, and injecting it where you do. But when performed improperly, there's a risk of a fatal fat embolism.
Some surgeons are injecting a little bit too deep. There's some important veins that bring blood from the lower aspect of the legs back into the heart, into the lungs.
29-year-old West Virginia mom Heather Meadows came to Miami for a Brazilian butt lift in 2016. She never made it out of surgery. The same happened to 40-year-old Kizzy London in 2017, also in Miami.
Patients should look for a plastic surgeon who's board certified by the American Board of Plastic Surgery.
And Dr. Jen Ashton is going to join us to talk. This is extremely serious.
Right. This is a big deal, Robin. So I want to put this into context with you. This is the actual warning that came out this week from 5 international plastic surgery societies. They title it an urgent warning. We spoke to a plastic surgeon this week who said a warning like this is unprecedented. They are considering even banning the procedure because the risk of intraoperative death, this means death on the table, is so high. And to put that into context for you, we heard in the piece 1 in 3,000. There have been studies done for elective plastic surgical procedures that look at over 1 million patients. The risk of dying on the table is 0. This procedure is more common, more popular. It's up 10% in just the last year. So this is a big deal.
Can you help us understand why this is the case?
Yeah, so let's do a little mini anatomy lesson here, Robin. If you look at the anatomy on the glutes, in the buttocks, we think of it in terms of layers. You have the skin, then you have the subcutaneous tissue there in yellow. That's where the fat should be going. Then you have a very thin layer called fascia. And below that, that is the danger zone, Robin. You have muscles, you have veins feeding those muscles. This is a procedure that's largely done blindly. So if the surgeon penetrates that fascial layer and gets the cannula into that deeper layer, fat goes into veins. Veins then travel to the heart and the lungs, and you can die on the table.
That helps you really understand that. So, you know, there are going to be some people who are going to want to take the risk. What do you suggest?
So this is something, the onus of responsibility has to be on the surgeon to counsel that there is a higher risk of death in this procedure. Patients need to do the following things. Absolutely go to a board-certified plastic surgeon. They do need to consider alternative procedures and techniques. There's something new called electromagnetic sculpting that is non-invasive, that can kind of stimulate the muscles. And then good old exercise, Robin. Just do those squats, drop it like it's hot, and keep it down and build those glutes.
What is the one that Chloe...
That is my medical advice.
No, but Chloe has this new squat. Remember, your daughter
That's right, split squats.
Yes.
We'll demonstrate that on Instagram.
Oh, okay. You're on. But thank you for that, Jen.
So anyway, those are 2 clips we have. We have others, but what I want to do is I want to bring our guest on after setting the stage for what we're dealing with. As you can see, there's quite a bit of problems with this particular procedure, but I want to zone in on some of the things that were said during both of these. So what I'll do is I'm going to invite my colleague first, Dr. Celeste Palmer, who just came in. She's in the world of pediatrics and saving lives. Hello, Dr. Palmer. How's it going?
Good. How are you
How was the clinic today?
I'll tell you about that later.
I was hoping for, hey, everything was fine. Okay, that's a longer discussion.
It was a great day.
Okay, no, that's good. That's good. But I'm looking forward to the details. But anyway, without further ado, I want to invite my friend and colleague, Dr. Kevin Smith. I first met Dr. Smith actually when he was a 4th-year medical student. I was an undergrad interviewing for medical school, and he was on his way to residency and all of that stuff, and soon to become a famous plastic surgeon. Dr. Smith, he was raised in Dallas, Texas, and he played quarterback This guy was a standout athlete. He played quarterback for the Dallas Carter Cowboys, and they were featured in the movie Carter High. He won numerous academic and community awards while in high school. He attended the University of Michigan on a football scholarship. He played cornerback for the Michigan, and while he majored in biology. Then he went on to medical school. He became, he's one of the few facial plastic surgeons board certified by both the American Board of Otolaryngology, that's ear, nose, and throat specialty, and the American Board of Facial Plastic and Reconstructive Surgery, which are two different board tracks. For nearly 2 decades, Dr. Smith has served as an assistant clinical faculty member in the Department of Otolaryngology at University of Texas Medical Branch in Houston. He was appointed to the Texas Medical Board by then Governor George W. Bush as a fellow of the American College of Surgeons. Dr. Smith was the first Black American to have completed a residency in otolaryngology at the University of Texas Medical School in Houston. He's also the first Black American to select and complete the facial plastic surgery fellowship at McCullough Plastic Surgery Clinic in Alabama. As a facial plastic surgeon, he has performed thousands of facial plastic surgery procedures. These include more than 3,500 facelift procedures, more than 3,000 eyelid surgeries, and hundreds of rhinoplasties. At the same time, he developed a niche treatment for migraines, which we'll bring him on the show for at another time. And he's world-renowned for this, treating migraines, headaches in patients with little-known cure. And he's done this with a special rhinoplasty procedure that he's developed. He's found more than 2,000 patients with migraines caused by a deviated septum or bone spur, which he's treated successfully in nearly 90% of those patients. So Dr. Smith is multi-talented. He's an avid golfer and has done extremely well as an amateur golfer. He is very dapper, and I think was awarded Best Dressed Houstonian back in the day, and was featured on the Today Show in the finalists of Best Dressed Person. So he's the antithesis of me, who's in scrubs most of the time. I think that same year I was runner-up for the worst dressed. But anyway, that's another story. We get to that later. Without further ado, Dr. Kevin Smith, welcome to Fresh Natural Live.
Oh, Baxter, thank you so very much. It's very nice to be here. Boy, I tell you.
It's so, you know, I want to jump into this topic right away. And, you know, you saw the clips there, and I know you don't perform Brazilian butt lifts, and I was aware of that when we talked earlier. But what I will say is that they got into the whole concept of plastic surgery, and the Good Morning America group says, well, you know, dangerous plastic surgery procedure. And then they went back and forth between plastic surgery and cosmetic surgery. And so, can you, just from a background standpoint, you are a certified plastic surgeon in 2 different boards.
Right.
And so you've gone through the rigor of general surgery, ear, nose, and throat, otolaryngology training, and facial plastic surgery training.
Right.
Can you explain to the audience the level of training you've gone through as a plastic surgeon, which would be similar to, you know, another plastic surgeon, and compare that to what somebody would be as a cosmetic surgeon?
That's a very good question, and it's something that I think the general public needs to understand. Take me, for example. I'm a facial plastic surgeon. I did undergraduate work 4 years. I then went to medical school for 4 years. I then did a otolaryngology or ear, nose, and throat residency for 5 years, and then did 1 extra year of training in facial plastic surgery, where that whole year, all we were doing was facelifts, eyelids, nose jobs, scar revisions, and things of that nature. So I was immersed in the facial plastic surgery during that extensive training. And then came out and just, as everybody else does, I've been practicing 30 years, and I've done thousands of facelifts, eyelid surgery, rhinoplasties. And of course, as you get better, you get more adept with it, and you get better at it, and you have more experience, then all that goes together to create a physician or a surgeon that is very adept at what they do and very good at what they do. The next segment of plastic surgeons you have are general plastic surgeons. These are surgeons who can train in OB-GYN or general surgery for 3 years or so. And then they go on to do 2 or 3 years in plastic surgery where they're doing burns, breast implants, liposuction, facelifts, some of them. But some of them don't do a lot of facial work. A lot of it is more body contouring and things of that nature, to include the Brazilian butt lift. But now, you have this Academy of Cosmetic Surgeons. And these are people who have not gone the traditional track where they've gone and done the residency in that area, but these are general surgeons, OB-GYNs, dermatologists, some oral surgeons that will come to these meetings, and they will learn how to do these procedures in a course at that meeting, or they might go and have a weekend course at one of the physicians that gave the talk at these meetings. Or you might go to a colleague that is also a cosmetic surgeon and learn how to do particular surgeries that you yourself would like to do, although you've not been trained in facial plastics nor general plastic surgery. And if I'm not mistaken, they may have a credentialing component of the American Academy of Cosmetic Surgeons. I know they have lots of meetings. I've gone to a few meetings, and because they present some things that are very interesting as well. But those are the 3 different levels. And as a consumer, it's important to know that. And it's important to know who does best with the procedure it is you're looking for.
Now, I noticed that in particularly in the first video clip we looked at, they showed the news video, and the center, the cosmetic surgery center, looked like a facility that could just be built anyways. It doesn't look like it's a regulated surgical facility. What is, I've heard of people doing cosmetic surgeries in their, garages and things like that. I've heard of that experience.
Right.
Well, and I say garage, I'm sure they kind of converted their garage to like a medical unit.
Mm-hmm.
But are these centers, are they regulated? I know that surgical centers or these cath labs are regulated and have to meet certain standards. And
yes.
I would imagine surgical centers are too, certainly hospitals do. What is the regulation of these cosmetic centers, at least do you know, in terms of quality?
Well, I can tell you that the trend is that a lot of plastic surgeons now are doing cases in their offices. Some of whom have built their own surgical facilities, and you can get like a surgery center. If you had your own surgery center, you can get that certified, and that comes with accreditations and different different rules and regulations that you have to follow, and certifications that are annual and things like that. And then there are others that do procedures under IV sedation and or general anesthesia. There's mobile anesthesia units that will come to offices and provide the anesthesia there, so that if you have a procedure room, you can actually perform procedures that are not required to go to the hospitals, but you can perform them in the office with board certified surgeons and anesthesiologists to get those procedures done as well. So it kind of runs the gamut. It really does. And again, I think it falls back on also looking at the surgeon that you're going to, their experience and their credentials, that they're board certified, and looking at the outcomes. You have to look at the outcomes of the surgeon. And it's very important that if you had an in where you might know a surgical tech or a nurse that works with these surgeons, that you could ask about how their technique is. Do they use the sterile technique properly? How is their technique in the surgery? Are they distracted by music and things like this and not paying attention? So a lot of things you can gain for people who are actually in the surgery with the surgeon. Other than that, you want to certainly look at before and after pictures, and you just have to ask the question, what is your complication rate? And I would review it and go down the list of complications. Just ask the surgeon. I'm always one to give people my stats, if you will, over the years. And I can say after doing 3,000-4,000 eyelid surgeries and facelifts, I've had no one die on the table, like was mentioned for the Brazilian butt lift. And of course, screening is very important. In my office, what we do too, if I'm going to do something in the office, I'm going to have a clearance done on the patient so that we pick up on any nuances of their medical history that might easily be overlooked. The anesthesiologist also goes over this so that we pick up on things. And if there's any question whether or not something can be done in the office versus then I tend to go and have patients to go to the hospital to have procedures done, or not do it at all if they're that sick.
Yeah, so I'm trying to do something with a mic here, but I may switch mics, but I'm not sure. But anyway, I'm gonna turn my mic down a little bit here. Hold on. Testing. That's not helping any. I'll keep playing with it. But anyway, so that's a good thing to look at, the stats. And we're going to get into that a little bit later, because oftentimes when you talk to someone and say, well, what are your stats? You know, I guess someone's not going to tell you, you know, I've had 5 deaths in the last week. I mean, you know, we have situations in the hospital setting where, you know, when people have bad outcomes, you know, there is a review committee, and you go before the review committees, and the review committees, they can be pretty, you know, aggressive and pretty lethal toward, you know, even minor outcomes. We're not talking about death, but just, you know, minor complications.
That's right.
And so, certainly in the hospital setting, I imagine certainly in the surgical settings, but these outpatient clinics is oftentimes a small group or an individual that's controlling that. So you may not have the review clinics go through that. So that's clearly something that I think, you know, we have to keep in mind when someone's having the procedure done. I think the screening you mentioned is important. Oftentimes people go to a lot of these places at a discount, and they go overseas or out of the country, which can be problematic, because, you know, there are stories I've seen online where someone goes out of the country, maybe go to Mexico, wherever, and they're great surgeons all over the world.
Yes.
I'm not criticizing it, but they may go and catch a deal, and it's cheap, maybe a few $100s cheaper. They get operated on and then get sent back like the next day, and they have complications, and they expect someone here to take care of them. And I've faced patients who've been in that predicament before, where I've had to do surgical clearance. They've had a procedure done, you know, in another country. They come back and say, well, another surgeon's going to operate on me and correct this problem. I need, you know, clearance. And in which case, they probably didn't get clearance there. Right. So that could be a tragic component about a tragic part of this whole situation. Now, Anita Daniels want to know more about the migraine treatment, so we may end up talking about migraines in part 2 of this. In fact, what I'll probably do, let me do this. I have a few people that mentioned migraines.
Oh, good.
And yes, Mary Thomas, I'm working on the feedback on the mic. I don't know. Dr. Palmer, do you have feedback coming from my mic on your side as well?
Yes.
All right, hold on 1 second here. Let me do something to the mic here.
Dr. Smith, while he's doing that, what's the youngest patient that you have done procedures on?
The youngest patient that what? I'm sorry?
Done a procedure on.
What type of procedure are you talking about? Specific anything?
Outside of things that are corrected for accidents.
Okay.
For cosmetic.
Cosmetic procedures. I think my youngest person was probably 14, 15, that might have wanted a rhinoplasty, but they were a mature size, you know, where you kind of looked at them and knew that the nose is about 85, 90% of an adult size. So yes, we can go and do that. Okay. Yeah. And then, of course, I have kids, though. I haven't done in a while, but children with the prominent ears, I've done otoplasties on, and they're 5, 6, 7, 8 years old. You want to get them done before they go to school. So that might be the youngest, yeah. Because kids can be very, very evil and mean, and they'll tease the youngsters that have the prominent ears. And that's a very easy procedure. I think that parents shouldn't be afraid of doing, and it eliminates a lot of hassle. So probably 5, 6 years old. Yeah, but I haven't done those in a while. Yes. Okay. Good question.
I've changed mics. How's that? I still have feedback?
You still have feedback.
Yep.
If I turn mine off, does it help you at all? How's that sound? Does he sound better? Say something now.
Testing.
That's better.
Maybe turn yours down. Maybe I think what's happening.
Okay.
Maybe if I'm going to your speaker and your speaker's going to your mic, so maybe turn your mic down.
I did. Okay, I hope that's better.
Okay, and we can still hear you too.
Okay, great.
Yeah. Okay, it's still a little bit. Maybe turn it down a tiny bit more would be good.
Okay.
So let me show these last two clips here and get your comments. And what we're going to do, we have a couple of people that ask about the migraine. So I want to.
Go to a migraine show.
That's your passion. So we're going to get into migraine. You're going to do a full migraine show with the private community because I want you to show some images. But let me show some of these other two clips real quick because I think they're telling. So hold on one second.
Well, the state of Florida taking action against a local doctor who performs plastic surgery in Miami. It's an update to a story NBC6 investigator Dan Krauth has been covering for 3 years now. He joins us tonight with the new details. Dan?
Yeah, Jackie, the Department of Health is restricting the license of Dr. Arnaldo Valls after one of his patients died after undergoing a Brazilian butt lift procedure. For the time being, he is not allowed to perform liposuction or a butt lift. Back in December, mother of three Kizzy London traveled from Louisiana to Jolie Plastic Surgery to undergo the procedure with Dr. Valls. In documents filed just this week, the health department says after Dr. Valls removed fat from her midsection and was injecting fat into her backside, he went too deep and hit a vein. The fat then traveled to her lungs, causing her to stop breathing. She went into cardiac arrest and later died. The health department also claims Dr. Valls lacks supervised training and experience in this procedure, even though it's legal for any doctor to perform plastic surgery in Florida, regardless if they're certified in this area or not. Our NBC6 investigations found she's one of 10 women who died after undergoing the same procedure. Our reports led to doctors from across the country to travel to Miami this summer. They're trying to make this procedure safer. They'll be issuing new recommendations and guidelines on how doctors should perform the Brazilian butt lift. A spokesperson for Jolie Plastic Surgery told me today on the phone they learned of the state's actions late this afternoon. She said Dr. Valls will remain employed by the center, will not be performing the procedures in question, and that he does plan on fighting the state's action. Valls is the third doctor involved in a death after a Brazilian butt lift procedure to face action from the state. We'll let you know what happens with this case. Live tonight, Dan Krauth, NBC6 News.
So that's a particular doctor who was sanctioned by the state. And then the point I want to emphasize there is that there was no regulations in the state of Florida. Now here's the last one I want to share with you, and then we'll get your comments, Douglas.
She was perfect this morning. She was happy. How could she be dead?
Only on 6, a mother with a warning tonight for women who are thinking about having plastic surgery. She says her daughter died for beauty and she doesn't want other families to experience the same pain.
The Miami mother's sharing her story tonight with NBC6 investigator Dan Krauth, who has spent years uncovering complications with one popular procedure.
There's not 1 minute that goes by that I don't think about her.
She went from planning her daughter's birthday one week to planning her funeral the next.
She was not just my daughter, she was my best friend.
Yolani Fadez's daughter, Danae, was beautiful.
She was beautiful inside and out.
But after giving birth to her third child, she wasn't happy with her body.
After her third baby, she gained a lot of weight and she just couldn't lose it and couldn't lose it.
She decided to go for a Brazilian butt lift procedure. That's where a doctor performs liposuction to remove fat from unwanted places and uses instruments like this to inject that fat into a patient's backside.
That was the last picture she sent me before she went in.
On May 10th, her daughter texted her right before surgery. She says she got the emergency phone call 2 hours later.
All I remember is falling to the floor. That's the last thing that I remember. I remember I had no strength in my body.
Her daughter died of a fat embolism. That's where a piece of fat gets into a patient's bloodstream and causes them to stop breathing.
I was like, oh my God, my daughter died like that.
The NBC6 investigators found she's one of more than a dozen women who died after undergoing the same procedure in South Florida, different doctors and clinics.
She's in the picture of a dozen or more. This is happening to many girls.
A family friend started this online petition calling for change to help prevent more deaths.
Think about it. If another girl goes through it and passes away, they're not the ones that are going to suffer. The family members are the ones that are going to stay suffering.
Our investigations over the past 4 years help lead to a new law that goes into effect next year, allowing the state to immediately suspend a doctor's license in the case of serious injury or death.
All in favor? Aye.
And the Florida Medical Board voted last month to prohibit doctors from inserting fat into a patient's muscle, a way to prevent deaths. Doctors have even issued new recommendations on how the surgery should be performed. But all of these changes going into effect after her daughter's death.
I love you, Dania. I love you, baby girl. Mommy will always be here for you, Mommy.
Our reporting led to a worldwide study that showed a patient is up to 20 times more likely to die from a Brazilian butt lift than any other cosmetic procedure. Doctors tell me there are known risks and side effects, but when done properly, death shouldn't be one of them. Dan Krauth, NBC6 News.
So I like the way they differentiated the Brazilian butt lift there and other plastic surgery procedures, which they didn't do in the other news report. And then the other article talked about the lack of regulations in Florida. I imagine other states that have lack of regulation. I apologize for my echo. I'm adjusting my mic. I've switched mics, and I'll keep playing with my settings until I get it right. But anyway, Dr. Smith, do you have any comments on that? Any of that information that came through?
The information from the last video, what struck me was that there's several things actually. It's good that Florida's taking a stance and against the doctors who have had these problems. I certainly think that a proactive approach is one that is needed because you want to try to prevent these deaths on the front end. You know, it's one thing to sanction a doctor to suspend their license on the back end, but you have a person who's died in the interim. And to have that many women to have died in South Florida means there are a whole lot more women across the country and then worldwide that have died as well. I think the number on one of your clips said that there were 20,000 of these procedures done. Well, last year there were like 60,000 done worldwide. And since 2015, the numbers have increased 70%. So it's continuing to go up. I think it's because, you know, when you look at it and you break it down, it's a harvesting of fat with liposuction, treating the fat, and then re-injecting it, which sounds simple. But then when you look at the technique and you look at the anatomy of the area that we're working with, one, it has layers that you have to know about: the skin layer, the fat layer where you want to inject the fat, but then there's a muscular layer, and those gluteal muscles aren't flat. They have a convexity to them. And the surgeons are using straight trocars and instruments to help contour something that is wanting to be rounded. So you really have to be astute enough to, when you're doing it, you're pinching the gluteal muscle and the whole backside to take this straight instrument, and you have to be able to feel and be able to almost see visually what you're feeling based on your experience, and take that straight instrument and inject it. And when you inject it, and if you come close to the dome of that, now you're getting where you're coming through and you're hitting the muscles. You get fat into a vein, it goes and travels to the lung and to the heart, and it doesn't take very much for that to happen. And then you get in trouble. And that's just about death, not to mention those who are just crippled from it and maybe who've had to be hospitalized because they survived the pulmonary embolus, and then others who get hematomas and get infections and get thrombosis, and the list goes on and on. So it's not an innocuous surgery. No surgery is. Every surgery is to be taken seriously by both the doctor, their staff, but by the patient as well. And when they're seeking to get these procedures done, you have to come prepared with your checklist of questions, checking it out. You want to bump the tires just like you do when you go buy a car. You don't just go buy a car because it looks good. You're going to look under the hood. You're going to drive it around. You're going to check the tires. You're going to see if it comes with the warranty. Do I want the chip service or not? Do I want that? You want to do the same thing with surgery. You have to go through your checklist and ask about everything that you can and investigate and look at the reviews and you know, a 5-star with 2 reviews is not the same as a 4.5 star with 1,000 reviews. So, you know, and every surgeon is going to have their complications.
Sure.
But those should be few and far between.
Yeah, I agree with what you're saying. And I think that you should also get multiple appearances, opinions, even before you have it. So you go talk to multiple surgeons. And
Yes.
you'll learn something by talking to different people about how they do things, et cetera, their setup, and so on. Person A, you may go and they say, okay, that's I do this X, Y, and Z. You go to person B, I do A, B, and C, and they say, oh, wow, this seems more logical. This seems safer.
Exactly.
I like the way your office and facility looks, et cetera.
Right.
So there are a lot of things you can learn by just going to different people in advance. And unfortunately, this young lady, it seems like she just went to that one person and had it done and had an unfortunate problem. Mary Thompson has an interesting question. It's not a dumb question. Why is unwanted fat re-injected? Basically, and it's a great question because and I didn't bring those news stories on. There are a lot of news stories on this, but there are other stories that talk about some physicians who are using things like silicone and other types of things that they implant other than fat that cause other types of problems. So fat, because fat that's treated and cleaned out, got in the blood, is ideal because it's from your body. So that's why it's ideal. So, and plus you're removing it from places. It's sort of like recycling, fat in your body, putting it and taking it from an unwanted place and putting it in a wanted place. So the idea and concept sounds good. It's just that you don't want to inject it in a vein or something like that. So fat is preferred, but it's the technique in this procedure that's the problem. And so that's really what we're dealing with.
I have a question too, because I'm not well versed in this area. But do you have to come back in like 10 years and get it redone? Get a refill?
That's a good question. I can answer that. When you harvest fat, when you do the liposuction, there are a certain percentage of the cells that will wither away or die during the process or wither away afterwards. So traditionally, you want to inject about 25% more or 30% more than you think you need because you're going to lose some of that. But typically, once it takes, and after about 6 months or so, when you're finally healed, you don't have to come back and get a refill or anything. But there might be some areas you might want to touch up because you may get some asymmetry or may get a dimple here or there or something where you might look at it and go, you know what, this cheek's a little bigger than that cheek. Can we put a little more in there? So that's surely to happen on occasion.
Mm-hmm. Yeah, I think, and I like your point about the technique. Time and experience is something that really makes a difference because you get the feel for things, and the longer a surgeon's been doing something, the more experience they get. Somebody can be experienced in a surgical area and surgery in one area, but not in that area. And using those particular instruments and those things can make a big difference. So anyway, what I'm going to do here is we're going to take a quick break, station break, and we're going to come back and talk about your favorite topic, Dr. Smith, migraine. There are a few people asking about migraine, so we're not going to hold back. We're going to let the audience have their way. So I think when we come back from this intermission, we're going to get into migraines. Hold tight. Okay, we are back. We're here with Dr. Kevin Smith, board certified ear, nose, and throat specialist or otolaryngologist, as we know, and also facial plastic surgeon. And he's given us insight into issues related to cosmetic surgery versus plastic surgery. And I apologize for the echo. I'm going to say as little as possible. I'm going to turn the mic over to Dr. Smith. And Dr. Smith, can you give us an overview of migraine headaches and your approach to migraine headaches? And people have this concept of migraine headaches. And so they get medications and various other neurological treatments and workups. and you found something quite interesting. So I'm going to turn the mic over to you. Talk to us about migraine headaches and talk to us about your approach and what you found in this area.
First of all, I thank you for allowing me to talk about this. This is my passion, and I've been doing it for 30 years now, but it was only recently, say the past 8 years, that I discovered that the root cause of migraine headaches is not in the brain, it's in the nose and sinuses. We've all been taught in medical school that it's in the brain, it's some vascular problem with vessels dilating causing the pain, but only 5% of brain scans will actually show something to explain a headache, an aneurysm, an abscess, something like that, a tumor. So I've been doing sinus surgery for a long time, and it was actually in my fellowship when my preceptor told me, you know, sometimes we do rhinoplasties and septoplasties on patients, and they would come back and say how they weren't having bad headaches anymore. So I practiced, once I opened my practice, I would just question people about their headaches, and invariably a lot of them who were undergoing sinus surgery would come back and say, you know, the bad headaches I was having, I don't have them anymore. So I found that very fascinating. It was so prominent in my practice that I ended up writing a book called The Migraine Imposter, because I thought these headaches were not true migraines, but migraine-like headaches. And they were so severe and debilitating that I did a lot of research in the subject, and there are a lot of studies that were done by ENT doctors talking about contact headaches in the nose, abnormalities in the nose causing these headaches. But nobody has ever made the link from that contact headache to migraine headaches. That leap was made by me after I was on the doctor's show, and I started getting these scans all across the country for me to review of people who had migraines. And mind you, these are people who have suffered on average 20 years. They've been to the Mayo Clinic, Cleveland Clinic, Johns Hopkins, University of Michigan, Vanderbilt, Diamond Headache Clinic, and the like. And some of them have been turned away from those places. And so hundreds of people were sending me these scans, and as opposed to the brain scan only having 5% positive findings, 100% of the people that sent their scans to me had these specific abnormalities that I know cause migraines. It might be a deviated septum, it could be large turbinates, it could be a combination of that with some sinus problems, just numerous specific things that I know. And when I performed my procedure that I call the Smith sinus migraine technique, I was finding that 90% of these people were never having another migraine. And these are people who have all type of migraines, not just migraines of people who have sinus problems, breathing problems, and allergies. No, I've cured people, families of people with hereditary migraines. I've cured hormonal migraines, ocular migraines, complex migraines that resemble a stroke, hemiplegic migraines where people get paralysis of their arm and legs, and the migraine, once I've done my procedure to correct the abnormalities in the nose, the migraine goes away, and all that hemiplegic aura and things would go away too. So it's very exciting because there are 40 million people in the United States with migraine headaches, and 1 billion people worldwide. And I think that the protocol should be that everyone, of course, should get a brain scan. But incidentally, when you look at the neurological indications of getting a brain scan, is somebody with a severe headache that also has associated neurological problems. But you know, we tend to fall in the ERs and stuff. You tend to want to make sure you don't miss an aneurysm or a tumor or something like that. So people get them anyway. And I've had patients that have gotten 14, 15 scans over a period of 20 years, and then they get one sinus scan, and I find what the problem is, do the surgery, and it's done. The surgery that I perform takes about an hour. It's an outpatient procedure. It's covered by insurance, a 90% success rate. It's not very painful. Most people say it's discomfort, and it's very effective. So it's very exciting. I mean, I had an anchor woman from Oklahoma who just did a story in Oklahoma and had one of my patients on who had had a hysterectomy to try to get rid of her migraine. She had a nerve stimulator implanted in her to try to get rid of her migraines. And while she was in the hospital, her mother was telling her that, you know, she started a prayer group at the church and all. And she just told her mother, look, stop, because I'm praying to just leave this earth. I can't take it anymore. So luckily she found me and we did a procedure, and she's been 2 years migraine free. She just had her nerve stimulator removed and she's very happy. So the results are very rewarding. It's just amazing to hear all these devastating stories. And from that story, by the way, that was run on the news, we got like 300 calls. And so I kind of chuckled when you told me that some of the patients here were asking about the migraines, and you just happened to just mention it, and people were having questions about it because it's something that is needed. People are not living their best lives, and what I'm doing is giving people their lives back. And people deserve to live their very best life, and they need to make sure that when you're dealing with a severe headache, which is what a migraine is, it's head pain, that you don't just check the brain, you have to check the rest of the head. So what I'm doing is checking the sinuses and the nose and solving a problem that's greatly needed.
You know, and again, I'm doing everything I can, so I'm still working as we're speaking to get I went and Googled cancellation, and I'm working on that. But to ask you a question, you mentioned a number of things that were quite intriguing, because with this procedure that you've done, you know, in the nose, you've cleared a whole myriad of manifestation of migraine, even with paralysis and the like. Now, I remember seeing on one of your news clips, in fact, you were on the doctor's show, where you went into some detailed explanation in terms of potential mechanisms of pathophysiology. And my understanding was that, you know, your nose reacts, you know, the soft tissue reacts in many different ways to sound, to smells, and different environments, maybe bariatric pressure, whatever the case may be. Mm-hmm. And it sends signals to the brain. Can you elucidate that for us a little further for our audience to help them? Why is it that when you go to the nose and pull out a bony spur in the nose, it gets rid of paralysis?
Okay. You know, it's a very, very good question. I'm glad you asked it because I love talking about this stuff. Let's start with, I have patients that have these symptoms associated with their migraines. I'm just going to tell you. They can have the syncopal episodes where they hear dizziness, slurred speech, blindness in one eye, tingling in the arms and legs, paralysis of the arm and legs, tremors, just tremors of the hands, and the list goes on. And also gastrointestinal problems, constipation, irritable bowel symptoms. So those are a few things. And patient after patient, I've had a 17-year-old girl just last week that told me that her irritable bowel is better. She can eat pizza and pasta. Her stomach is flat. It used to be bloated all the time. And it's all related to nerves when you think about it. So when you have this abnormality in your nose, and the nose projects from the face, it's close to the brain, it's a protective structure and very sensitive. I tell people now, when you get a COVID test with the swab going in your nose, it hurts, right? Why? Because the nose is very, very sensitive. Well, these abnormalities in the nose that are brought on by injury, and let's think about it, the first injury is coming through the mother's birth canal to get born. You know, your nose is getting pressed up against the sacrum. They can grow and have this deviated septum and other abnormalities in the nose that can trigger the pain. So you have this abnormal structure in the nose, irritating sensitive tissues, sending signals to the brain, and along the way, you have to imagine it's electricity. You can have a single lightning bolt that strikes a tree, but you can also look in the sky and have lightning that you see that goes along the sky and into the clouds. And so for those people who have these myriad of symptoms that accompany the migraines, they're getting the latter where it goes across the sky happening in the brain. So the signal goes back, there are lots of nerves that are converging, and the electricity skips and hits something else, and they're the ones that get these symptoms of blindness and weakness and slurred speech and tingling and tremors. So once you remove that abnormal signal, that abnormal impulse, then you remove the ability of the electricity to come and do what they call it's called a cortical depression, where it spreads out in the brain and hits other nerves along the way back. So when I remove that, it removes the nidus, it removes the irritating focus, which removes the electrical impulses that are abnormal, and that's puts your body in a state of just calm.
So Kevin, when you mentioned something interesting, so you have a myriad of these symptoms, irritable bowel and various other things. Do these people have these symptoms in the context of a headache, or can these symptoms occur remote from the headache?
They can. I had one patient. What was that? What was that?
How do you link them together?
Here's how I linked them together. Very good question. I had one patient, and let's just back up. Baxter, you have to understand, I'm a very curious doctor. I've been that way since I was a kid. And so instead of me, I'll learn what you taught me in med school, but I want to do things and then I want to see how you react. Do it, see how you react. And I take mental notes of it.
That's right.
And so that's how I came to this, Bax.
Yeah,
I came to this because I'm very, very curious. And I don't take no for an answer. The body is made to be very logical. If there's head pain here that's so severe you can't work and you're disabled and you're considering suicide, we have to find why. And it's got to be somewhere in here.
Yeah.
It just does. I mean, we may not know it, and because we don't know it, it's mysterious, but once you see the results, then you know you're onto something. It's important that you follow up with that. So I had a patient, 27 years old, migraines for 9 years, constant headache every day. But during her period, she would have her migraines. And when she'd have her migraines, she would pass out, have dizziness, have paralysis of her legs and arms. She had to be medevaced from Belgium. She was on a mission trip, had to be medevaced back to the United States because she just fell out and they didn't know what to do with her. So she comes here and I do the procedure and get rid of the migraines. And she has not had in 3-4 years all those other weird symptoms that came along with her migraine. So I looked up migraines. What else are they associated with? What are the neurological disorders? There's a list of about 30 to 40 things. MS, dementia, ALS, chronic fatigue, irritable bowel, Crohn's disease, autism, Tourette's, Parkinson's, Alzheimer's. And when you look at the symptoms of all of those disorders, Baxter, I can pluck out the symptoms and plug them into my migraine patients. And these are conditions that are associated or comorbid conditions with migraine. So of course, being the person I am, I'm gonna ask, well, why is migraine associated with all this stuff? And when I look at all the symptoms of all this stuff, it's similar to some of the symptoms that I have in my migraine patients. So is the root cause that I'm finding in the nose actually leading and contributing to some of these other disorders? That's my question. And I have to tell you, Baxter, I had a lady in my office, migraines for 20 years. She worked for a neurologist. He just recently, before she worked for me, she worked for a neurologist. And then 4 years ago, he diagnosed her with MS. So she comes in, I did a scan on her, just a screening scan. And by the way, I do screening scans in my office all the time. You don't have to be a patient. You just call and say, hey, I have this condition. I want to have a CT scan, and we'll do it. It takes about a minute to do that. So I did her scan. She has classic abnormalities that I find in my migraine patients. And so one day she came in and she was walking with a walker, a little cane. I said, what's wrong? She said, my MS is flared up. I said, okay, let's go into the office and let me spray your nose with a topical. I have a topical anesthetic and decongestant spray. I sprayed it in her nose to shrink things down. I knew it would help the headache because it does. It shrinks the tissues away from the septum or whatever it's touching. And I knew it would help the headache. So the headache goes away, but 30 minutes later, she comes back and said, Dr. Smith, I don't need to use my cane. I feel better. And so I put her on some allergy sprays and stuff like that. And ever since she's been using that, she said her MS symptoms have been better, but we're going to do her surgery next month. I've had a gentleman who was a Hall of Fame defensive back with severe dementia came in and he got a scan. He has the same findings of the lady with the MS and my migraine patients. I had a young man come in who had Asperger's. I scanned him. He has the same finding in his nose that I find in those other patients. I had the young girl with the irritable bowel. I had one lady also, what got me onto that, a lady who I called for telemedicine to see how she was doing. She said, my migraines are gone. She said, but you know what's so strange, Dr. Smith? I said, what? And I'm so glad she told me this. She goes, I've had constipation since, I'm talking about severe constipation since I was 19 years old. And I don't have constipation anymore. I just go to the restroom. And I hear these things, Baxter. I'm looking at these, I'm listening. I'm like, okay, so that lady and the young girl with the irritable bowel, that's telling me that abnormal signal here was giving abnormal signals to the abdomen and the intestines. The intestines don't know what to do. They're not coordinated. They don't know how to get rid of the feces. So it just stays stagnant. But once I get rid of it, then everything's back to normal.
So you got my brain working here, Kevin. This is a highly dangerous interview we're doing here. Before I get into some of my thoughts, Celeste, how often do y'all see migraines in the pediatric population?
Quite common in pediatrics. And, most of the time, the things that we start out doing is recommending a headache diary. But with the children, the things that we run into is they're taking in a lot of processed food and sugars. They're up on the computers all night in the dark. They're not drinking enough water. So it's so many other things that are going on. We have to get that straight. And then I'm sure that we could get to the level where Dr. Smith could help them if we could get the other things kind of lined up better first. Because I think this generation is on the computer and on the iPhones and iPads so much that it creates some form of headache.
Yeah, that's interesting. And again, certainly lifestyle, we see that a lot with a lot of these conditions, irritable bowel and the like, certainly with lifestyle. But, as I'm listening to you, we do know that a lot of these syndromes, irritable bowel and the like, are connected to the central nervous system. And what I'm hearing you say is that the nose is connected to the central nervous system. And so this is another contributing factor, not only to migraines, but central nervous system mediated clinical manifestations. I mean, migraine is one thing, and we like to put labels on things. But what I'm hearing you talk about is potentially central nervous system mediated abnormalities. That could be a cardiac arrhythmia. Now
Well, I thought about that with, say, AFib that just all of a sudden spontaneously occurs. It may be worth us looking and scanning those people just to see what they have.
Yeah, and I think, and these things are multifactorial. I like Celeste's point is, I think, spot on. There are a lot of things that go into these, areas of problem. And certainly lifestyle and our complex issues but we work very hard. I can think of a couple of patients offhand who have irritable bowel issues and have had them for a very long time. And so I may get on the phone with you, not in the not too distant future, and have these people evaluated, because I'm all about hitting these from every angle that I can. And you're looking at something that's a common problem. And is it always the bone spur or the other types of?
No, there are other things too. And let me just tell you what you're doing, Baxter, is very important. And what Dr. Palmer mentioned too about the inflammatory diets. Changing your diet certainly will help, because anything inflammatory is going to cause the nose to swell, okay? Which then makes the contact points of those abnormalities more severe, which makes the headache more severe, and the associated aura that go along with the headache more severe. So if you can reduce the inflammation with your diet that you talk about, your cleansing, Dr. Montgomery, that you talk about, then that all helps what I do as well.
Gotcha.
And it helps, and Dr. Palmer, it helps those kids. You're right. You can't be eating inflammatory foods, because on one hand, some of those kids are going to be too young for me to even operate it on, if they had the the abnormality. And certainly the diet, if it helps, is something that they could do until they got of age. But certainly I have helped some pediatric patients, though, by being very conservative with some of the things that I can do with them. Some of them have bone spurs that are just so horrible that you just have to do the procedure. And I think the youngest I've done was 10 years old.
So I guess we're looking at a spectrum. So as you point out, certainly lifestyle, and if you have a horrible lifestyle, you're going to make things so bad. Maybe by just correcting that, a lot of people are going to be taken care of, because we've had people with headaches go away and things like that. But this helps me explain headaches in general, but all these other central nervous system mediated sequelae.
Right.
And maybe there needs to be kind of a comprehensive assessment. And I think we should talk about how we deal with that, because we may be onto something, and maybe looking at it from a combination of things that we do.
Yeah.
Wow, this is very fascinating.
It is, Baxter. It's very. I'm so glad you had me on. It is. I see your little eyes twinkling, because I know when we get off the show, we're going to be on the phone for a couple of hours talking about this.
You're reading my mind.
I know.
You're right on point. Here's a question. We'll make this the last one. We'll run up on an hour, but this is great. Is reducing inflammation in the nose using essential oils reasonable? Any comments on essential oils in the nose?
Well, anything that will reduce inflammation, yes. Some of those essential oils are natural vasoconstrictors. Eucalyptus, menthol, those things, they will make the nose decongest. So it helps as long as the abnormalities aren't so severe. Some abnormalities are so severe, no amount of decongestion is going to help.
Can I ask a quick question?
I'm sorry, go ahead.
I said, can I ask a quick question?
Oh, sure, please.
So, I've always wondered the etiology or the reason for cyclic vomiting. So with, because a lot of times we'll see children who have cyclic vomiting with migraines. So is that a way that the body is trying to totally cleanse itself to decrease inflammation, maybe?
Now, you said cyclic migraines?
Cyclic vomiting, which is kind of started by the migraine. So they have a migraine first. They start having cyclic vomiting, which means they repeat vomiting over.
Right. Yes. Yeah. Severe pain can lead to vomiting like that. Yeah. It just, I experienced one time I hit my knee. I didn't know I hit my knee one time on my desk. The worst pain I've ever had, even playing football, I've never had that much pain. And I immediately got nauseated. And it helped me understand that, it's severe pain that leads to nausea. I don't know why it does it, but it does. And it certainly does explain the cyclic vomiting and things.
And so there's a question about where you locate, Dr. Smith. I did put your website. Let me see here. Let me put your website address. What's your website address? It's kevinsmithmd.com. And I have two offices, one in River Oaks and one in Spring, Texas. Okay. So I'm going to put this in the chat, and I'm also going to put it in the on the feed here. I'm going to make a quick banner and put it on here. I thought I had put it in the notes of an astute group that we have.
Just put you want to put the phone number just to have them call? Oh, there you go.
I will then put the phone number.
It's on the website, though.
What's the phone number?
It's on the website. Oh, it's 713.
Okay, it's on the website.
It's on the website, yeah.
Okay, good. So what I'll do is I'll leave that on the banner, and I'll also make a little scroll here, make a ticker, and so that'll go on. And we
technically expertise there. I'm impressed.
I can't get rid of my echo, but I can make a banner. How about that? but kevinsmithmd.com, y'all can find him on his website. Dr. Smith has been very enlightening. And you read my brain. You will be getting a phone call. I won't keep you up too late, but I do want to pick your brain and share some thoughts with you, because things have been ticking. And Dr. Palmer, as usual, thank you very much. And I'll be calling you, finding about how your day with the kiddos went.
Okay.
And so I got a number of calls. So guys, thanks a bunch. I'll see y'all backstage.
Thank you very much.
As I close out. As usual, I learn a lot, and I think I learned much more this time. And Dr. Smith and I have been friends for a long time, and we talked about headaches, and I think I've got a few more pearls tonight than I've had before. And so I hope this has been enjoyable for you. We did talk about cosmetic surgery and plastic surgery in general, and you heard from one of the country's top surgeons, plastic surgeons and otolaryngologists. And he gave some insight into a very common problem that he's found a special approach to helping people resolve, and that's migraine headaches and related syndromes. So I hope this is very informative for you and very insightful. If so, as always, give us hit the like button, show us some love. Also subscribe if you hadn't had a chance to do so. Hit the notification buttons because you'll get notifications of future talks, enlightening discussions and conversations. And please share this this talk with anyone and everyone that you think will benefit from it. But until next time, keep it fresh, natural, and live.